you all for being here tonight for the talk on 4 important aspects to lifetime care. This is probably one of the most important talks that I do because we all need to take care of ourselves. I'm Dr. Paul Firnhaber. This is Lincoln Disc and Nutrition. And tonight we're going to be talking about, and talking to the community about how we take care of ourselves. So we're going to talk about 4 important aspects to taking care of yourself for your lifetime. So, what are most people's approach to lifetime care? There's a lot of dogma out there that's founded on cliches and not any substance at all. And for example, the first one is that if it doesn't hurt, it must not be a problem. Well, you can have a brain tumor for a long time and have no symptoms at all. That's a problem. You can have heart disease for a long time, have no symptoms at all. That's a problem. A lot of people are walking around with fatty livers, don't know it. They're walking around with degenerative spines, and they don't know it. So this is a significant misconception about lifetime care. And these attitudes are not a basis for sound health care. So that's like saying if your engine isn't seized in your car, you don't change the oil. Well, we change the oil because we want our car to run good. We want it to run well and to last a long time. And everybody wants new and better. We want cars that are safer, faster, more service conscious, and we need to take care of them when we get them. So that doesn't mean that people always want to pay the price to be healthy, okay? Sometimes people make fun of people who exercise regularly, take vitamins, or eat a healthy diet. I've been called a health nut, and my answer to that always is, well, are you a disease nut? And so, or they may ask, is it true with your chiropractic care? Didn't they fix you yet? You still going back there even when you don't have pain? We're going to address those things this evening of some of these objections. So one of the first things I want to say is that each of us are designed from a blueprint that provides a template for vibrant health. The degree to which we reflect that blueprint is determined by the quality and quantity of care we provide for our bodies. So if subluxations are present in our spines, our blueprint is altered and vibrant health is diminished, resulting in accelerated aging. And that's just the way it is. If you want to age fast, allow your spine to degenerate. Allow your nervous system not to work right. So let's talk about exercise and reading, for example. Exercise is really, really important, but we don't exercise today to prevent a heart attack tomorrow. We exercise because it really enhances the entire quality of our lives. It even enhances the meals we eat, and I've noticed that exercise decreases my appetite. Let's talk about reading and using our brains. We don't read and use our brains today to prevent a headache tomorrow. We use our brains and we read because we know that it helps our brains to work better. It doesn't deteriorate as quickly. And we know that one of the most common problems now in our culture, one of the most serious problems, is dementia and Alzheimer's. So when we use our brains, that prevents it from deteriorating. That's not a theory. That's a scientific fact. It's a reality. So that brings us to lifetime care, a discussion that many people will not engage in. So people that do talk about this and come to these talks are in a minority. It's a minority of this population that decides to take care of themselves regardless of how they feel. It takes a certain level of evolved thinking to realize that you don't just respond when there's a crisis, when you're starting to develop issues. So, do you wait till your house is seized before you respond to the IRS? Do you wait till you have a heart attack and need open heart surgery before you take care of your heart? You shouldn't, okay? Maybe you would, but you shouldn't. So let's go to important point number 2. Lifetime care is not an outcome, but it's a process that we are constantly engaged in. When are we going to be done exercising? When are we going to be done eating healthy, eating the right foods? When are we going to be done brushing our teeth, praying, loving our family? Anything that we do for the virtue of existence is a process, not an end result. And we have to be engaged in that, in a process that we're never going to be done in. You know, we're never done taking care of ourselves until we die, really. Now, some people, when they start chiropractic care, hear stories that you have to go for the rest of your life. You don't have to. You can quit any time, okay? You don't have to go for the rest of your life. Why do people keep going? It's because they feel better. They function better. They become more aware that their bodies work better, and they want that level of health to be with them. And they experience more health and vitality, not just a reduction in pain. And I hear this all the time. People say they have more energy, their digestion works better. You know, they move better, they function better. And that's why people stay with chiropractic. So let's talk about a woman I had in my practice. And not everybody can make sense of this. So I had a woman who was in she's a young lady, she's in a car accident. I treated her regularly for 3 months. And she told me after that 3 months, she said, you know, is it a coincidence that my menstrual cycles aren't as painful as they used to be since I've been coming here? No, it's no coincidence, because we're turning on the nerve supply to her pelvic organs by adjusting her lower back. And, you know, people tend to not understand things like this. They don't understand that the nervous system is connected to all of our organs. And when you start working on the spine, which is a switching station in the body, the electrical fuse box of the body, and relieving some of that nerve pressure, things work better. So let's talk about important point number 3. Caring for your body or your health is something that you do at certain moments and not at other moments. Actually, when it comes down to it, we render care at every moment of our existence. Even our thoughts constitute care. So Hans Selye was the one that discovered how stress affects the body. And what he found was that stressful thoughts, emotional upsets, causes cancer to grow faster. Now, he was persecuted for this, and people didn't believe him at the time. Today, it's accepted that the thoughts we keep can accelerate the pace at which disease itself takes over. Adopting the right attitude can convert a negative stress to a positive one. And that's one of his quotes. Reiki Hamer was a German physician. In the early 1980s, produced absolute proof that every cancer has a negative emotional origin, and specific diseases have very specific emotional traumas associated with them. For example, lung disease or lung cancer is grief or sorrow. Stomach and small intestine is indigestible anger. Liver is starvation of love. And he found that there's a very strong correlation between certain symptoms, certain cancers, and certain emotions. So we render care to ourselves by the beverages we choose to drink, whether or not we choose to exercise, the food we choose to eat, how much we chew our food, which I can say that I'm not as good at as I should be. Whether we smoke cigarettes, whether we drink to extreme, whether we have limited sugar or too much sugar. And I've talked to multiple people who coincidentally ate too much sugar over the holidays. Okay, it's just shocking, I know, but this is it. And most of those people were sick or had symptoms afterwards. and I saw it very consistently. Whether we consume artificial sweeteners which damage nervous system function, are we rendering care to our body every living and breathing second? What about when we sleep? So when we sleep, if you go to bed mad and that percolates in your brain all night, that probably isn't very good for your body. The Bible said, "Do not let the sun go down on your wrath," and I think there's a reason for that.
Yeah.
So even when we're sleeping, we should go to bed with positive, happy thoughts. That isn't always easy, but that's what we should do, because that percolates in our head while we sleep. So lifetime care is not a choice. The only choice is a quality of care that we're going to engage in. So for the friend that says, "Are you still going back to a chiropractor?" the question really should be, are you continuing to make greater and improvements in the types of care that you're rendering to yourself? In other words, are you improving the way you're taking care of yourself, and what are you doing to do it? Those are questions that friends of mine and I engage in a lot, especially the friends that really take care of themselves. So let's see, these next couple slides relate to COVID. So the chiropractic adjustment is still the fastest and most efficient way to stimulate the immune system. 21 papers were found that explore the impact of chiropractic adjustments on neuroimmune markers. And that's in a journal called Medicina in May of 2021. So the same article states the following: studies have shown that chiropractic adjustments may positively impact various aspects of autonomic nervous function: heart rate variability, cardiovascular function, respiratory function, GI function, and genitourinary function. So, important point number 4. Okay, you remember the first 3 important points? Number 1 is that symptoms don't necessarily determine our health. Okay? Number 2 is that health is an ongoing process, that it's not a destination, it's ongoing. Number 3, the third important point was that we render care to ourselves all the time, every waking moment. Point number 4, my back pain health issues should be able to be corrected quickly with just a few adjustments. Not necessarily so. Can a lifetime of slips and falls, auto accidents, no matter how insignificant, bad posture, poor diet, and significant stresses be corrected in a few days or a few weeks? So what if over a period of 10 years, you gained 100 pounds? How long would it take to lose that? Could you lose that in a few weeks? No, you couldn't. How much work would you have to do to lose it? A lot. So if you come in and you have a lifetime of abuse to your spine that's giving you symptoms, you may not be able to correct that real fast. It may take months, maybe a year, maybe 2 years to really get it under control. And this is something that a lot of people don't understand. Something that they've had for years and years cannot necessarily be corrected in just a few weeks worth of care, and certainly not with a few adjustments. So about rendering care to children. Children tend to catch things. They learn to do what's caught rather than what's taught a lot of times. And so when you get chiropractic care, when children get chiropractic care early on, they learn that chiropractic is helpful, and kids that are adjusted are a lot healthier. They don't get colds as easy. I'm not saying they never get sick. They don't get sick as easy, and they don't get as sick. So my request to you as your doctor of chiropractic, who takes care of your spine and your nervous system, which controls all your body functions, is to do your spinal exercises, which I give you, and pay attention to workplace ergonomics. Remember, The ligaments that we have that hold our bones together tend to harden if they're not used. Chiropractic adjustments keeps those ligaments supple and fertile. Okay, and if they're not used every 7 days, 5 to 7 days, they tend to get fibrotic, which is why exercise and chiropractic care is so important to keeping your ligaments healthy. Now, some people have a habit in their life, their lifetime care is going from tragedy to tragedy, health crisis to health crisis. I know people like that. In fact, I know a lot of people like that. If that's the case with you, you won't like our office, because we encourage lifetime care based on wisdom and deliberately engaged choices that actually help keep you healthy. So our society gives us a lot of confusing messages about healthcare. People go on Google, they go on YouTube, and there's some good stuff on there. You know, I watch YouTube videos, and there's some things on there that are pretty good. There's some things I disagree with. But that's why I have these classes, so I can clarify things and answer questions about how to take care of yourselves more effectively. So I'm not necessarily here to treat how you feel, okay? But I'm here to make sure that your brain and your spinal cord are operating at their greatest possible capacity so you can be your best. That doesn't mean you'll never be sick again. Doesn't mean you'll never have the symptoms you came in with. Doesn't mean that. It just means that you will age slower and that you're going to repair more efficiently. But it's a process. If you spent 30 years creating the problem you came in with, it may take some years to get it fixed. So my prayer for you is that you can continue to be informed throughout your life, and that you try and consume less drugs, less pharmaceuticals on every frontier. Now, what do you do if you have a medical crisis and you have to take pharmaceuticals? Well, my advice would be go to your physician and say, look, I know that right now these pharmaceuticals may be the best, worst thing for me. So I'll take them if I have to, but I want you to get me off of them as soon as possible. As soon as we can, I want to get off of these pharmaceuticals. Pharmaceuticals leach all the vital nutrients out of your body, and a lot of them really screw up the microbiome and the gut bacteria. So you don't want to be on them for very long if you can help it. So my question to you is, who do you know out there that is not well and does not know what you know about chiropractic? Who do you know? Those are the people a lot of those people are sick. They can't get better. They don't know what to do. They're trying invasive therapies that may not be necessary or good for them. Have them come in here to my office and at least get checked. At least get checked out. And, you know, if I can help them, I'll tell them. If I can't, I'll try and get them to some place where that can help them. But more than likely, a lot of those people probably could benefit from chiropractic. We do a complimentary 10-minute spinal screening. That we do that at our expense. And then if there's a problem, we'll tell the patient what we need to do and we'll go from there. But at least get your friends checked, or get checked yourself if you're not seeing a chiropractor. So that's all I have for tonight. My wish for you is that you make 2025 a healthy year for yourself, that you eat healthy, that you get checked for chiropractic problems, subluxations, that you exercise regularly, and that you keep a positive attitude. And so that's my goal for our community, for my office, and for all my patients. So thank you very much for being here tonight. And in 2 weeks, we're going to be doing a brand new talk called Healing the Dysfunctional Gut. I've never done it before. It's a very powerful, very important talk. We're going to do that in 2 weeks, so I'll see you then.